Hey guys, white coat hypertension is a classification almost the same thing as pre-diabetes. The name says that you have a problem, but we're not going to do anything about it just yet. In fact, we're not going to do anything until it gets worse. The classic scenario is when you come to the doctor's office for a cold or a cough, or more often for a checkup, like a wellness exam, a physical, and your blood pressure shows up as being high. Usually what we'll do is we'll take it again and see if it comes down. Sometimes if it initially doesn't come down with a second check or checking in the other arm, then in cases like a DOT exam where it's crucial that we have a normal blood pressure before signing off, we'll have you lay there quietly or in the dark, just breathe a little bit for a couple minutes and then check your blood pressures again. The problem is that regardless of the outcome when you check it again, there is an elevated blood pressure. You would think in stressful situations that blood pressure's going to be slightly elevated, and then when the stress goes away, then they go down. But in the case of the temporary blood pressure response, white coat hypertension, if the initial blood pressure is high, and I'm talking about anything greater than 170 over 100, then the likelihood is high that you're going to have a problem with that blood pressure sooner or later, even if it's just coming out because of stress. The stress response is supposed to increase your blood pressure, increase your heart rate, increase your breathing in preparation for fight or flight rescue. And that's to save you from danger. But in the case where you have that kind of a response in a doctor's office or just in the pharmacy when you check your blood pressure and the little thing you sit down in, technically that's not a fight or flight situation. But regardless, we figure out that if it's only temporary and it doesn't stay, then it's probably safe. That's the thinking. There is no research as of yet that says people with white coat hypertension will die. But there are ongoing studies that show people with the diagnosis of white coat hypertension will sometimes go on to full-blown hypertension in due time. Kind of like that analogy with prediabetes. If prediabetes has been followed long enough and there's no intervention, like weight loss, exercise, food control, then the pre-diabetic becomes a full-blown diabetic within about 5 to 10 years. Thinking about the standard American diet and the average American lifestyle, if you have a high blood pressure response in situations that don't require a fight or flight reaction, that might tell me you'd benefit from an exercise routine, meditative practice, mindfulness practice, nutrition guidance, weight loss. But that's why the relationship between you as a patient and your doctor is very important. Our job is to keep you out of danger. When my patients come in with elevated pressures, I would always say, okay, why is it elevated? How fast can it go back down? What are we doing with body mass index? What are we doing with lifestyle? Are we using too much alcohol? Is there too much salt in the diet? All these things have to be incorporated into figuring out a lifestyle plan. Not everybody gets the same plan. Not everybody gets put on medications. In times of danger, medicines are very useful. But before that step, lifestyle change is important, and it can work. I have a lot of people that get on low sodium diets, mostly whole food, plant-based eating, and they do fine. The problem is if those practices and the lifestyle changes can stick. Most of the time, the activities that got you to the point of high blood pressure or white coat hypertension have been there for a long time, and it's hard to shake them off. It's hard to change what is habit for you. But that's the importance of seeing somebody who will watch out for your future. If there is a deviation away from healthy, then it's up to the doctor to design a way to not go down that road where eventually you're going to have full-blown diabetes, or eventually you're going to have high blood pressure and it won't come down anymore. Even if you have to be put on medicines, my fear is that when people get treated for high blood pressure or white coat hypertension that's not coming down, and it's only in the form of a prescription, the likelihood is high that if no lifestyle change is introduced, then you're going to outrun that medicine. That medicine which can control and bring down your blood pressure will eventually not work anymore, and you'll need a higher dose or a second medicine. And oftentimes I'll see these folks and they come in with these many medicines to see me, And it's a shame because no one told them that there is a way to do that, lower blood pressure, without having to crank up on the medicines. It's going to be hard. You have to face the facts that you have to invest time, money, effort, but in the long run, you will be happier and healthier, and you'll have less side effects from medicine. Ultimately, high blood pressure, if uncontrolled, leads to stroke and possibly heart attack. When you put high blood pressure as a diagnosis, in addition to an increased waist size, it's called the waist to hip ratio, in addition to a high cholesterol level and a sugar that's high, that puts you into a metabolic syndrome. And from that point, you're on your way to seeing a whole bunch of specialists, cardiologists, kidney specialists, diabetic specialists, and you're going to have to go back and do the stuff that you're supposed to do in the first place. Exercise, lose weight, stop smoking, lower sodium, get on a whole food plant-based diet, all that stuff I talk about. That's why I harp on it so much first. So the bottom line is, if I meet somebody and their one blood pressure reading is a little bit high, I'll check it again. If it's still high, I'll tell them, go home. As long as we're not having chest pain, headaches, numbness or tingling, nausea, vomiting, or blurred vision, take your blood pressures at the local pharmacy, give me a random blood pressure reading a couple days in a row, send me the numbers, and then I'll review them outside my office. If they're all high at home, then the likelihood is that we do have a high blood pressure issue. And at that point, we'll look into how your sleep is, if you're getting exercise, how your magnesium level is, what your sugar level is, what your salt intake is, and we'll work on things. I think just working on breath and movement, stepping away from the stressors of work will actually lower blood pressure. If the blood pressures outside my office are all normal, no big deal. The value of preventive care is to actually prevent something, not just wait for it to occur. If a disease is found, we can use the biggest gun medicine in the world, some of the best techniques on the planet, and take care of things in the United States. It'll cost you a lot of money. You might be temporarily disabled. At least we'll be able to take down the severity of the disease process and then work from there. An ounce of prevention will do you wonders if you heed the warning signs, and if anybody's actually looking for them. Might just mean, how big is your waist? How many times do you exercise in a week? How is your sleep? Are you taking too much alcohol? Are you drinking too much coffee? All those easy things you'll get from the questions and answers doing your physical. It's not just doing a physical exam, it's getting the history and learning about the patient. Learning about weaknesses, learning about strengths, and embracing those things and making you bulletproof. See my other videos for 4-7-8 breathing, resetting your sleep, and exercising for heart disease. If you found this information helpful, give it a thumbs up, and don't forget to subscribe for weekly words of wisdom. And don't forget to subscribe for weekly words of wisdom.